whole lot's going on.
Oh,
it
yes.
was a late night for a lot of folks watching the debate between the vice presidential candidates, but we got some late breaking news from the Commission on Presidential Debates about next week's presidential debate. Well, they were supposed to do this virtually. That was the announcement. But not long after they made the announcement that Biden and Trump would face off virtually, well, the president pushed back and said he is not going to participate at all. So now that is up in the air about next week's debate. But for right now, the president said he is not going to participate if it's going to be virtual. We shall see.
More to come, I'm sure, on that. Dr. Jen Ashton, by the way, tracking all of this with us up late as well. I saw you last night, Jen, reporting from home today. New COVID cases, we should mention, are up now, as is ICU usage at hospitals nationwide. So let's take a look at the key data we are watching closely from Johns Hopkins University now. More than 36.1 million confirmed cases of coronavirus around the world, at least 7.5 million right here in this country. And we now have more than 211,000 American lives lost. And Dr. Jen, we heard yesterday President Trump's doctor announcing he had tested positive for the antibodies. That triggered a lot of questions. So what's the latest on that? What does it mean?
Well, first, Amy, let's review what we know about antibodies thus far. It generally takes about 1 to 3 weeks after becoming infected with SARS-CoV-2 for a person to develop these IgG antibodies. I want to be clear. We've said it before. They are not used to diagnose an active infection. We still don't know how much protection these antibodies give a person, and we also don't know how long they last. And in particular, with respect to President Trump, it is very possible that the Regeneron antibody treatment that the president received last week could produce a false positive, depending on the assay or test methodology used to do that antibody test.
And we know this is not your patient, of course, but still everybody's wondering what this means now. What are the implications of this for the president? And what would this mean for the average person out there who tests positive for antibodies?
Well, excellent question, TJ. And according to infectious disease specialists, this does not and should not alter one's behavior at all. They still need to wear a mask. They still need to keep their distance 10 days from the onset of symptoms or 10 days from getting a positive test. And again, what's interesting about this is it's really hard to tell at this point whether that result was due to the treatment President Trump got. There is some data to suggest that those two treatments, Regeneron and remdesivir, can lower the viral load, and as that happens, make someone less contagious. But that is unknown at this point.
All right, Dr. Ashton, it is so weird in studio without you right now. It's bizarre.
It's so quiet.
Yeah,
I miss you guys.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.